Hi, my name is Corinne, and today we're going to talk about treatments for dementia. So, currently, there is no cure for dementia. This is due to the different stages which occurs that makes it hard to detect in other diseases causing dementia, such as Alzheimer's or vascular dementia. Thus, there are only medication and therapies that therefore may help manage the symptoms. I'm sorry. Um, so in terms of medication, there are Aricept, Axalon, and Razidine, and they all three work in boosting levels of a chemical messenger involved in memory loss and judgment. And so these medications are primarily used to treat Alzheimer's disease. However, these medications can also be used to treat other dementias such as vascular dementia, Parkinson's disease, and Lewy body dementia. Their medication is Namida, and this works in actively regulating glutamate, which is another chemical messenger. And this chemical messenger is involved in brain functions such as learning and memory. And side effects are dizziness. And so, what we can infer with the medication is that it is that they are trying to mitigate as much as they can with the symptoms that starts to occur as the disease tend to progress. Um, in terms of therapies, there are behavioral techniques such as positive reinforcement, differential reinforcement, life review reminder, reality orientation, validation therapy. There's also sensory interventions such as touch therapy, music therapy, massage therapy, exercise physical therapy. There's also environmental interventions such as creating personal space for the individual with dementia, reducing stimuli such as noise. There's also social therapies for the individual, which could include pet therapy, structured activities such as games, group activities, and unstructured activities such as home activities, folding clothes, and gardening. So, as you can see in the behavioral therapies in the pictures, there is a patient with dementia looking at photo albums and with their family just to kind of remind them of who they are. You can also see shows the dates, the time, the seasons. It's just to kind of give them a reality it's pretty much reality orientation, allowing them to understand where they are, who they are, in like in present, and what day it is, what season it is, and allowing them to recognize that. Um, in this picture, it's like validation therapy, or even like you can also say like positive reinforcement. In terms of sensory therapies, like you have exercise, touch therapy, like holding hands, music therapy. That might like music therapy can tend to bring a lot of these patients comfort. You also have environmental therapies, such as like having a dog, pet therapy, like a dog to be there, and like even reducing loud noise. In terms of dementia with family care or caregiving, it's important to understand that the individual with dementia, diagnosed with dementia, and their family should understand what dementia is and the effects it has on the individual um, cognitively and social and just socially in terms of functions such as behaviors, risk factors, safety issues that the family might have to consider. Um, and so, yes, so in terms of the family, it's really important to show support with the family member with dementia, and like allowing a strong line of communication between the family member diagnosed and with the family as well, and just kind of continue with the social interactions and just having a strong supportive um, and understanding relationship with the individual or with that family member would really help a lot, it's just because the individual being diagnosed, they're already overwhelmed, and um, having family support and just reassurance will help the process a lot. And in terms of the patient being diagnosed with dementia, like I said, it's important to understand what the disease is and the effects of the disease. And it's possibly important to go to a local support group or even get individual or family counseling. But it's also but it's very vital for the individual diagnosed to stay involved with their family, and to stay active. It's also really important because as humans, we really thrive off of social interactions. And so it's important to kind of keep those relationships and those things to continue